Welcome back to the channel with me, your host, Dr. Deborah Durst. And I have a surprise. I have a new co-host or a different co-host today.
Yes, we are not replacing Miss Faraday, but I am Nicole Campbell, nurse practitioner at Revitalize.
So Nicole is relatively new to us. Well, she is new, 3 months now, just a little bit past the 3-month mark. And so she's going to be sitting in on some podcasts and having a discussion over various topics. So we're just opening more opportunities to get other, perspectives on things. So, but today it just so happens that we're going to talk about Melanotan, which is a peptide, but Nicole and I have it in common that we both like and we are using Melanotan. So we decided that that would be a great topic. Lots of questions on it anyhow.
I'm excited.
Yeah. So what do you think overall? You've been using it?
I've been using Melanotan for 2 weeks and I love it. The skin color that has come out, the pigmentation, it's just beautiful gold color that I feel like my skin's glowing. It just been great. I haven't been having to go out in the sun. It just does it on its own.
Yes, I love that. So Melanotan is something I've been using for probably 5 years now. And again, I used to get pretty dark anyhow. And so it's not like I use it that often, but I always maintain color even in the winter. So it is a peptide. And if you are unfamiliar with peptides, it means that it is a protein. So they're amino acid sequences, peptides are, that are mimicking something in the body that's natural. Most of the time, fully the same peptide is in the body. Sometimes there'll be a slight variation if they couldn't get it perfectly, like they'll do segments of things. But this one is an amino acid sequence that stimulates alpha melanocyte stimulating hormone, which is going to increase your melanin production. Your melanocytes are going to produce more melanin, which actually cause your darkening or tanning. And so that's what this peptide does. And that's exactly what it did for you. But I think that I like to start with, there's a couple different versions of it. And we actually did Melanotan II. Initially, that became unavailable for a short period of time. And now we're doing Melanotan I. So we can talk about the difference between the two.
I'd like to.
Yeah. Perfect.
So
I'll let you can do melanocyte 1 since that's what we're doing.
Okay. So melanocyte 1 is used for tanning. Like she said, it's a receptor, melanocyte receptor. It can cause you to have skin darkening, which is what we want, but it also can cause some of our freckles to be a little darker than we want. So that is something to know because pigmentation happens all over. It's used for sunless. It's also photoprotective. So it does have some protection from the sun just by using it, which I have found great. And they consider it the Barbie Peptide.
Yes. So Melanotan overall, which is Melanotan. That's like the long version. The brand name Melanotan is the other. Again, there's a 1 and 2. I would say that we started with 2, which tends to be a broader amino acid or peptide for melanocortin, the receptor stimulation. So it does more receptors. So it's a broader, not as specific or selective as Melanotan 1. But it also is stronger. Sometimes the opposite is true. If something's more selective and specific, it's actually more potent. But with the broad, which was Melanotan 2, it actually stimulated more receptors, but was actually more potent. And so maybe there was less use before you got the tan and maybe a lower dose. But Melanotan 1 works the same way, but it actually is more specific to one particular receptor. And that's the one that increases the melanin production the most. And so it does cause a tan. So it's going to increase melanin production, even if you had a low level that you might not have known before. So pigmentation, like you mentioned, is pretty common. And so I always warn people about that. And I just say it may not be for everyone, and you may or may not like it. And so you really don't know until somebody tries it. For me, I am freckled anyhow, and so it would bring out the freckles more. But also, you could potentially lift that pigment a little bit, especially if it's in spot areas where you're lifting that pigment with a laser, a light laser treatment or IPL, and then you get that smooth. So I find for me, when I use Melanotan and then I do an IPL period, and I always do at least 2 of them a year, my skin looks amazing and I love it. And so it does just give you a specific glow.
It
Yeah.
does.
And so for anyone that isn't familiar, again, peptides aren't available from everywhere, and they are a prescription. So they do need to be prescribed by a provider. And so you'll get a lot of talk about peptides online, and where people will actually kind of comment back on our videos on peptides about the fact that you can get the same peptide online. But if you can get it online, it's actually, number one, not legal because you're not seeing a physician or a provider and being prescribed it, but also you don't know what you're getting then. So if somebody's providing it that isn't legally doing it, then you would question. And so you've seen some of the peptide science or heard some of our patients talk about that.
Yes.
What have you heard them say
That
frequently?
they are getting it from an online source, but it's not giving them the effects they want. Makes me wonder if you're really getting it. What is it that you're getting that you're injecting in your body? So it's people are able to get them outside of a prescription from a provider, but it is definitely not recommended.
Did you look at like peptide science, for instance, and see what they say on their website? It's like research use only, like not even animals.
Yeah, it'd be concerning.
Yeah. Yeah. Not for living.
Not for living people, needs more clinical trials, needs more testing.
But definitely like an investigational and not for human use. So again, you're getting it from a site saying it's the same, but you're actually getting it from a site that says not for human use and using it as a human. So again, right there just kind of doesn't add up that it's not the same, because ours are prescription coming from a regulated compounding pharmacy. And so doubly regulated from a federal level and a state level. And definitely not illegal to use in humans. So, again, Melanotan 2 being a little more broad, but more potent, one being more specific, but they both cause tanning. And the instructions, typically, we don't get into dosing because every vial and provider and pharmacy that you're using might prescribe a different amount in a milligram in a vial. And they may even have you reconstituting it a specific way. Therefore, if we said you're going to get 10 milligrams and you're going to give this much, it may be different. And so we don't give out those specifics for that reason unless we're prescribing it. But usually you're injecting it once a day for about 2 weeks.
Once a day for about 2 weeks is what I've been doing. And then just a maintenance dose, like once a week or once every 2 weeks. And then if you need to kind of pick it up a little bit more, you can kind of go back to a couple more days to just been kind of playing with it to get myself my color that I like. So
yeah, and I always tell people that it's once a day for 2 weeks and or until you get a tan. So if you have, like, you got a tan that you're pretty happy with, prior to that you're a little darker skin tone and you get some pigmentation or you get the color you want and you're at 7 days, that's fine. Whenever you get the color you want or you get something that you don't like, then that's time to cut back to half the dose and usually just a couple times a week. Is that kind of what you've been trying? And then again, adjusting it, because some darker skin types might need it once a week, once every 2 weeks, where somebody else might need to stay on that consistently if they're lighter skin type. And then not everyone will love it for the reasons, number one, of pigmentation. And so you may get darkening. And a lot of people will say, is IPL or something like that. Is that able to be done if you're on Melanotan? And the answer is yes. You just are a darker skin type. So you cannot have an IPL done if you have a sunburn or recent sun exposure. But if you haven't recently upped your dose, a significant change, you're still changing, then you basically are at a pretty stable. Once you get to a stable color and dose, then you're just a darker skin type. And so, yes, you can lift, but you want to go to somebody that can do that appropriately and take all those things into consideration. But
And so remind me, IPL is?
so again, Nicole's new to the office, so she's learning all the aesthetic part of it. So IPL is intense pulse light therapy. And so it's more a broader light therapy where we have other lasers like a DermaV that has a more specific, like 532 wavelength for more of a KTP type of laser, where those lasers are more specific, the 532 for picking up pigment. And so with IPL, though, even that broad spectrum light will lift pigment, whether it's red or brown pigment. And again, you can burn people with that. So it's definitely not an easy laser to use because it depends on skin type, sun exposure, all kinds of different factors based on the patient. But I will say that there is a study that shows that if you had 2 IPLs a year, that your skin aging is significantly decreased. So they did a study where they pulled some providers at the beginning, and then 2 times a year they would do IPL, and 10 years later they actually looked younger than the initial assessment. Yeah, and so that is why I always do at least 2 IPLs a year. And I do love my skin after an IPL. And you can do all kinds of lasers, you know, for skin rejuvenation, but IPL will stimulate collagen, but also lift that pigment. So you just get an even skin tone. Yeah, but it can be, again, it has to be done under skilled hands for sure, and somebody very experienced with it. And that's why a lot of people are afraid of lasers, is because they haven't been to somebody that's really experienced with it. And so sometimes there'll be burns if they're not done right. But IPL is one of those. Yeah, you'll get that eventually.
Okay.
You'll be there because I think but that's not something you should do in the summer. And definitely, it's on a stable dose of so that your skin you're not changing. It's not like you're acutely exposed to sun. You are just a different skin type after, and a darker skin type. But one of the other side effects that you get, because that's another reason why some people don't like Melanotan, and I'm sure you can speak to the other significant side effect.
It gives me a little nauseous, so it does cause a little nausea, but that was remedied by taking it at nighttime. So instead of me dosing myself in the morning, I changed it to night, and right before I went to bed, I gave it to myself and didn't even know I was nauseous because my progesterone puts me to sleep so well.
Yeah, and then the Barbie part of it too, which is funny. So the Barbie is because the other couple things that you might see that maybe aren't adverse, but
yeah, so it can also cause some weight loss, decreased appetite. It can do some fat burning, and it also can increase libido. So they kind of get a little a threefer.
Yeah, a threefer. That's why it's called the Barbie Peptide. You might be more tan, you might lose some weight, and you might want sex more often. Yeah. So, but I think that's a cute term for it anyhow. And then increased erections with men. So even though libido can be, like I do hear men frequently talk about that, increased erection quality with Melanotan. PT141 is a subsegment of Melanotan, and that's where I say some of them can just have segments of peptides, which again are amino acid sequences. And that one is specific to sex and sexual function. So increased orgasmic strength, all of that. We have other videos on that. That was the other thing, that we'll get flushing with a lot of peptides, and we don't get that with Melanotan. That's not a usual. It's really just some potential boosted side effects that are actually probably benefits more than anything. And flushing is not one of the side effects, but nausea can be. And then that pigment, and it just isn't for everyone. And so if you wanted to try something that might give you, that's the other significant thing, was the photoprotection.
Some protection that you get from it.
Yes. So melanin production in the skin is actually to protect the skin against sun exposure and the damaging effects of it. And so when you have increased melanin, you actually have potentially that protection, and you can get a tan without any sun exposure, but sun activated Melanotan just does it. It does it quicker. And I feel like and you can tell me if you have seen anything different from a data or like research, but I feel like it's protective because you aren't out in the sun as much either to get the tan, because a lot of people, even if they had a skin type 1 or 2, are going out and they're spending a lot of time because they have to get a tan. But now they don't have to go out that long and they can still get a tan. So that's another reason why it's sun protective, and you don't really burn on it. And part of that is because you don't have to be out, but I do know some people that abuse it, meaning that we say limit your sun exposure. That's how it's protective. And if you don't limit your sun exposure, all bets are off for the protection part of it. And so, but those that are out more than they should be still don't burn. And have you noticed any burning at all?
No, and I've been out in the sun for extended periods of time over the weekends.
Oh, so you're an
and
abuser, huh? Yeah.
I didn't notice any kind
Yeah,
of any kind of burning or, but I wouldn't do that routinely with
Yeah,
that.
no. And you actually, it's good to be out in the sun.
Yeah.
To get that sun activated part of it. You just don't need, and again, it's always good to use sunscreen anyhow. And you're going to be outside. You're going to be doing things outside. But laying out is what I mean by the abused, like they're actually laying out for a tan and full body exposure. And then a lot of them are lighter skin types and really shouldn't be out anyhow. So that is a significant benefit of Melanotan. I will say that one of the reasons why it came to market way back is the University of Arizona was doing studies on it for tanning, and they actually were using rats and injecting the rats with melanoma and then giving Melanotan to see if it would increase the melanoma growth, just to see, because again, we don't use it in skin cancer patients just because, again, you don't want to use it in a patient that has a history of melanoma. But knowing that at least they tried to give a rat or inject a rat with a melanoma and then give it Melanotan thinking it would grow and that would be an adverse effect. But it actually was a decrease in size of the melanoma after injection with Melanotan. So that was at least reassuring that, we're not sure that it causes any of that because, again, if it's a protection and it's melanin production, there's no formal studies that actually show it to have a melanoma effect, but we just don't use it because we don't know. And there's no large studies for Melanotan. But again, so from a patient standpoint, science aside, you like it.
Love it.
All right.
Yeah.
Perfect. And I've been using it again for 5 years. We did a reconstitution video. So if ever you have peptides that are provided by a provider, written by a provider, and you have questions about reconstitution, we do take you through that video. And it was me doing Melanotan. And at the time I was like, I'm never coming off of it. And I probably never will. And you can just get to a low dose that works for you. So if you have questions about peptides or Melanotan, then please drop them in the comment. Let's start a conversation. And then let us know if there's anything else you want to talk or discuss, because we are willing to deep dive into anything wellness or sexual wellness.